Hello and welcome to Women's Health. Women's Health is a series of programs that are hosted by the Women's Foundation of Lincoln and Lancaster County. Today we're going to be talking about situations or events that happen in childhood that can have long-term effects on the health and development of us as adults. Today our guest is Kathy Karsting, who is here from the Department of Health and Human Services. Kathy is the program manager for the Maternal Child Adolescent Health program. So we're really very glad to have you with us today, Kathy. So really what we're talking about is some research and some results about situations or experiences that children have had, and we call these the ACEs. And those adverse childhood experiences, then what their long-term effect is. So could you tell us a little bit about what is ACEs and how did this come about?
Well, thanks for your interest in the topic, Kathy. The ACEs studies, the Adverse Childhood Experiences studies.
So there's our ACEs, Adverse Childhood Experiences, okay.
Yes, and really what the body of work represents is large-scale and repeated population research that has been conducted since 1997 and then in iterations after, that was undertaken to really explore the significance of trauma in childhood to later life events, including health risk behaviors, risk for disease, healthcare burden, healthcare costs, social problems later in life. And so it's a large body of research that really sheds light, I think, on some really compelling messages for all of us, that some things that happen to children, while they may not leave a physical mark, may not result, for example, in failure to thrive or something that we would see,
right,
that these experiences can really impact brain development and behavior and really shape who we are as adults. And from a public health perspective, I think it really opens our eyes to many, many important messages about the well-being of children we know and in our communities.
Right. And then to realize the impact that has on all of us, not only because children are such an important and special thing in our lives, but also what as adults happens then does affect all of us, does have a long-term effect on the collectivity, which is very important to all of us as well. Yes. Okay, so what then are the adverse childhood experiences that then are going to contribute to these long-term health problems?
Through the research that has been conducted, primarily with Centers for Disease Control, number of states, large groups of populations, they undertook these questions of adults over the age of 18. Tell us about the things that happened to you in childhood, then let's look at some of your health and social issues now. Well, through this work, 10 particularly significant events were identified. Obviously, many things occur in childhood, but 10 critical events seem to really distill out of this work. And some people intuitively recognize abuse, for example, whether it's physical, emotional, or sexual. Well, right there are three of the ACEs in
very
experiencing
ones, yeah.
abuse. And then 2 more, neglect, both physical and emotional, and I think many of us would intuitively recognize that those can be damaging experiences for children. The other 5 significant ACEs that have been identified reflect more on the circumstances and experience of the household. And I think this was particularly groundbreaking about these studies, to look a little wider in the experience of the child. So the additional 5, then, the remaining 5 of the 10 ACEs, besides those named in abuse and neglect, include alcohol or drug abuse in the home.
In the home.
Where the child lives.
Okay.
An emotionally disturbed, depressed, or mentally ill family member also is very disruptive and can translate into adverse experiences for the child. Where the mother is treated violently, that again is an ACEs, and where a household member is imprisoned or incarcerated. Finally, the last one, where a child actually loses a parent to death or abandonment. That loss of a parent is the 10th ACE.
Right. Okay. Well, I think you're right. I think that obviously, you know, as an outsider looking in, if we see that a child has been abused or if a child has suffered from malnutrition or something like that, that seems really relevant. But we don't always realize that circumstances within the home can really make a huge and long-term effect on that person, and maybe not just emotionally or mentally, but as well physically. Then a lot of physical ailments that can eventually result. What about if we're talking about more than one of these things? Is there a bigger impact if they have more than one of the adverse childhood experiences in their home?
Yes, and really I think there are 3 telling findings of the ACEs research for us to consider. The first is that in the measures of populations where individuals are asked, please tell us your ACE score, and those questionnaires are available. Well, the first is that the research found that in all studies, wherever it's been replicated, more than half of the population has experienced at least one adverse event in childhood. And a significant portion of the population, about 15% of the population, may have experienced 4 or more ACEs. So from this, one conclusion is that these adverse experiences are much more pervasive in our communities and in our society than previously had ever been measured. The second is that the effect of ACEs does seem to be cumulative. It's not that that there was an effort to say, oh, for example, sexual abuse is worse than physical abuse, is worse than, more that of these 10, the more you have, or the more intensely, repetitively, or prolonged
and over a long period of time.
An ACE. Right. So it's this idea that ACEs are cumulative in their impact. And particularly statistically significant is that individuals who have experienced 4 or more ACEs seem to be the population where there's a very strong association with greater levels of health risk behaviors, greater levels of chronic and acute and other types of health conditions, and a higher probability of death or disability due to health effects. Wow. So the pervasiveness, the cumulative nature, and then this this insight that we had, I think many people intuitively recognize it, but really to see the science underlie the notion that when these events are part of your childhood experience, there is a strong, scientifically shown relationship with who we become as adults. And I think that for me as a nurse, as a healthcare professional, is one of the most riveting topics in the sense of perhaps others have felt this. I know I have over the decades I've been practicing, thinking about, oh, the very young child, the things they'll forget, the things they'll grow out of, the things that perhaps will change, and we no longer need to think about that, and to really come to terms with the fact that we're learning more and more and more about a child who is deprived of nurturing, safety, stability, good positive relationships in their life, really grows up with different brain architecture, which leads to different behaviors or propensity for behaviors and risk-taking, which strongly relates to risk of disease and disability and social problems later in life. Seeing it laid out this way has been very, very powerful from the standpoint of really taking stock, for example, from the viewpoint of the healthcare system or the school system. I think it really opens up new perspectives on, do we assume every child is all right unless showing otherwise? Or do we really need to be much, much more sensitive than ever before that children come from very, very complicated lives And even as children, they're coping with many, many, many challenges.
Right, and that we need to address the fact that long term it can make a lot of difference.
Right.
And that just moving away or moving out of that situation or whatever isn't going to make it over with.
Right.
That's really long term.
Right.
Let's talk about what some of those things are then that are the adult sort of consequences. When we say that they have long-term effects, what are some of those long-term effects? In other words, if a child has experienced several of these ACEs, the adverse childhood experiences, what then do we see are the result in adulthood? I mean, we're talking about the consequences, but what are those consequences for the adults?
In how the theoretical construct here is emerging in terms of asking adults, what did you experience as a child? What are your health and social problems now? The intervening period seems to be in that adoption of risk behaviors. And so, of course, today, in thinking about the well-being of a population, we're very interested in things like tobacco use, drug use, alcohol use, suicidal tendencies, depression, and so forth.
Okay.
So what we see in sort of a first tier is that individuals who have experienced high levels of adverse experiences in childhoods, fast forward into adulthood, may be more likely to indulge in risk behaviors that will produce health problems.
Okay.
And it may be in the, I think really we can be realistic about, well, perhaps some of those risk behaviors are actually trying to take care of oneself, you know, self-medicating, for example,
right.
Or self-calming or regulating. So we do see people with higher rates of alcohol use, higher rates of tobacco use, higher rates of obesity, and those relationships carry out, as I say, again and again in populations studied. So there's a greater adoption of health risk behaviors. And then, secondly, the emergence of a greater health burden as a result of those health behaviors and maladaptation. So a greater risk of cancer, a greater risk of cardiovascular disease, a greater risk of complications, for example, liver cancer or liver cirrhosis that's associated with the higher risk of alcohol use earlier
diabetes,
in life.
that
Right.
kind of
Diabetes associated with obesity, with cardiovascular disease.
as well as mental health issues.
Oh, absolutely.
Great deal of
absolutely
that too.
true.
Right.
And I think that's where subsequent studies have shown, for example, that where we look at specific populations that might be described by their health needs or their risk behaviors, so individuals who are in mental health care settings, receiving treatment for mental health problems, and individuals who are in substance abuse treatment, it seems like there we can go to those particular subgroups and find very high ACE scores among a very high proportion of the population.
Sure.
And
That
again,
makes
that
sense.
reinforces this relationship of the one to the other.
Right. What about the significance to women? This is a program about women's health, and
Yes.
although we're really
Yes.
talking about everyone here, and we certainly want to, do we see any differences among women when it comes to the
Yes.
results of these studies?
I think there are some very significant considerations for women on several levels. One, I think that's very important and that we see, I think, really emerging in important ways in the healthcare system and in the behavioral healthcare system is an awareness that individuals who require healthcare services, behavioral health services, may have trauma history. And I think a really important movement that's emerging, particularly in women's health care settings, to really be looking at transforming our care systems to be much more sensitive and informed about the fact that in populations of women and others, there may be a high number of individuals that have very significant trauma history. And so I think some of the most important work that comes out of these research studies is from clinicians and providers who really are taking stock of some of the ways we provide care in the healthcare system and are really recognizing and articulating in more and more ways that we must be respectful. We must assure that we really are giving the opportunity to be informed and to refuse any type of care or service to adult individuals. That sometimes in the manner in which we may have given care in the past that's invasive, paternalistic, perhaps in some ways demeaning or even humiliating, takes on a sense that we may be reenacting or re-traumatizing a woman over something that in time has happened in a completely different time in her experience, but that through restraints, seclusion, isolation, humiliation, failure to intervene, to let conflict go on in some of our care settings without intervening. All of these things can be re-traumatizing to women or reminiscent of trauma that they have experienced. And I think as a nurse and other caregivers, the principle of first do no harm requires us to rethink how we deliver care to women we do not know. And for example, one of the most sort of first principles is that when we encounter individuals in the healthcare system, it's important in our assessment to consider asking the woman to share some of her past experiences and to determine if she's ever had trauma before. So I think the significance for the women's health care system is happening as we speak, that more and more providers recognize that many women have received or have experienced trauma, harm, injury in their past, and that for us to actually help address the health problems that they are presenting with today, we may have to take the time to be much, much more sensitive to the trauma that they experienced in their past than ever before. I think another issue for me, for women, too, about the ACEs is thinking of women as caregivers for their family members and, of course, as parents. And the ACEs studies, at least in my work, have really helped illuminate how much we are shaped by our childhood experiences in how we ourselves carry out our relationships, and particularly parent.
And be parents, yes.
And it's really been quite revealing, and I've experienced this in parenting education that I do too, that when they have the chance to reflect on it, I think whatever skill level we may be at parenting, we're all in on-the-job training. And I think when given the opportunity to reflect on this, I have met many parents who will say, I know I need to parent differently than I was parented. And I think for the ACEs study and the information that these studies bring us, it really brings so much relevance to that. And I think we really can honor much more the needs of adults who say, I know I need to parent different than I was parented. And I think in our work in maternal and child health, it really suggests that there is so much we could accomplish, perhaps, by supporting parents better than we do now, particularly those parents who say, I know I don't want to be the parent that I myself experienced, but I need some help
to
find that.
And although sometimes it's easier said than done, obviously, because really as you grow up, the only experience you know is the one that you're living. And as a child, you're learning those behaviors and those principles from what you see. So if you have never had a good role model, if you don't know what that means, then you can in your heart know that you don't want to be that kind of a parent, but to just say that isn't enough. You have to know really what to do.
Oh, yes.
So then let's talk about what then are the next steps. Now that we have this information, now that we realize that adverse childhood experiences does really have long-term effects, then what does it mean for the healthcare community? You've alluded to it a little bit, parenting kinds of things. But then as well, maybe what does it say to the schools? What does it say to us as a community? What can we do?
I think the significance of the ACEs studies are really far-reaching, and the more people that reflect on it or have the opportunity to really inform perhaps the work that they're doing, the potential for change is really very good, I think. And as a public health professional, I guess I think of things that happen on the big high level, our systems of care, things that happen in communities that a group of well-meaning people in a community can drive, and then of course what we do in our own relationships and our own behaviors. So at the systems level, the ACEs studies really do tell us that the population that we are trying to serve through our behavioral health system, our healthcare system, our public health system, our school system, the population that we are trying to serve perhaps has needs, significant needs, that we have not yet really recognized and begun to address effectively.
We're kind of doing a Band-Aid effect, you know, let's treat this, let's treat that, let's treat that, without really coordinating it and realizing that it's a whole huge issue, and not just let's treat that, treat that for the person.
Right.
Yeah.
And of course we problem solve with the resources that we have at hand oftentimes. So in school settings, for example, we might consider a very stressed child, a child who perhaps is living in some of these scenarios where a person is incarcerated and someone has mental health problems or is depressed, and maybe there's violence in the home as well. And so this child has no physical marks on them, but is extremely stressed by the adversity that they're part of at home and what they experience. The child comes to school and perhaps has not slept, has not been fed, and has poorly regulated behavior. And then the school's response, of course, is to intervene to try and get the child as quickly as possible into a learning mode. And I think the changes suggested by ACEs suggest that as we are intervening in an acting out of a child, that perhaps we should be very, 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 very careful about teacher behavior that either comes across or is heard by the child as humiliating, or is demeaning, or when the teacher chooses to isolate the child or seclude the child, to really have a moment in time to consider what that might be reenacting to the child in terms of awful experiences that they have at home. So I think the one important area for schools is to really look at discipline. And I think a very important movement to say there should be no restraint, there should be no confinement, there should be no seclusion or humiliation in the child, and so that sort of gets at the heart, you know, of some teacher dynamics in the classrooms that do involve a culture change in schools. In the healthcare system, some of the strategies are a little bit more straightforward. For example, in thinking how we change our assessment, how we gather information. And so one of the phrases that we hear associated with ACEs is that we have to move beyond what's wrong with you. What is your presenting problem that I can help you with today in our clinic? But more to considering the health and well-being of the individual, and to take care to ask what has happened to you. and what has gone on in your life, and a significant reminder, I think, to all of us who are in systems to care, to remember that what through our eyes may look like acting out or maladaptive behavior may in fact be a very significant message to us that this is a person who has experience coping with or adapting to very dangerous and disturbing situations. And so it helps then to move our focus of intervention, not so much to stopping you acting out like that, but more to really try and get a richer perspective on what are the things in your life that may need to be healed, or for which you need to receive treatment that then in turn will unfold a better path for you.
Right.
So it's an interesting
and even looking at health, like what we would call physical health problems, you know, having a long-term illness like cancer or having a long-term illness like heart disease or whatever, we have to look at the whole experience as well before we can help that person to whatever, change behaviors or to change lifestyle or whatever.
Right,
That's
right.
a very important issue for a practitioner, for
yes.
sure.
And just a note about prevention and the light ACEs sheds on that. As we consider, for example, the health burden economically and in terms of life lost in the United States due to cancer and cardiovascular disease. The notion here is that perhaps our prevention dollars are better spent in improving the conditions of childhood than they might be spent in screening adult populations for high blood pressure. So it's to give us this view of where prevention might best be leveled in order to make a difference in the health burden that we are seeing in the United States in our adult population.
Right. That makes a lot of sense. So then, myself as an individual, any of us as individuals, what should we be sensitive to? What does this say to us as individuals?
I think the messages are for us to, this is me, the public health professional, but it's to really rethink what our commitment is as a community to young children and their families in supporting their parents. One of the most important protective factors that communities have for children is their awareness of child abuse and the willingness of community members to report child abuse, to bring forward, to name that a child is observed in adverse circumstances, and where communities let their guard fall, where people are not ready to act on behalf of a child. I think that is very detrimental to us all. And so as community members, we can be aware that when we do see a child in harm's way, we each do have a responsibility to gather in the community systems of care to try and help. And I think it's too, in just thinking about how we live our lives and how we share in the well-being of the community in terms of the relationships that we have with all of the children that we know. Each one of us has the opportunity to be a trusted adult in a child's life, no matter what their adverse circumstances are, and be part of that child acquiring the skills of positive coping. So even if we're a neighbor or a teacher or a nurse or simply a concerned citizen, I think all of us have the opportunity to convey that we are concerned for the well-being of a child and that we are willing to act on behalf of a child who needs us to act.
Very good point. Well, thank you so much, Kathy, for being here with us. This is Women's Health, and today we have been talking about the adverse childhood experiences that children can have that will eventually maybe lead to long-term health effects. What I'd like to do is give you more information by having you look at websites. We'll have some things posted at the end of our program so that if you would like to look more specifically at this topic, we will have some information for you both here and also on our website, which is the Women's Foundation, lincolnwomen.org. And thank you so much for this very important information.
Thank you, Kathy.